Okay, so diving into this deep dive MDMA-assisted therapy for PTSD, you sent over a ton of studies and clinical trials, which is great, because there's so much talk about this right now. And honestly, I'm really curious to see what the research actually says.
Yeah, it is a pretty fascinating area, especially because it really challenges how we think about treating trauma.
For sure. And it seems like you're interested in getting a full picture of how this therapy works. Not just does it work, but the actual science behind it.
Yeah, definitely.
So we'll look into all that and of course compare it to more traditional treatments and look at any potential risks.
That sounds good. And what's really interesting to me is how MDMA, a drug that's usually thought of as a party drug, is showing this potential for helping people heal from really deep trauma.
Yeah, I know, right? It's kind of mind-blowing. But before we even get to the MDMA part, we should probably start with the trauma itself, how deeply it affects the brain and the body. I was reading The Body Keeps the Score, and it makes this really good point about how traditional talk therapy and even medication sometimes just don't fully address the impact of PTSD.
Right. Trauma isn't just a mental or emotional thing. It's it gets into your body, it changes your nervous system, your hormones, even how you see the world.
Yeah, and in the book, there's this wild comparison to stroke patients. It talks about how during flashbacks, Broca's area, the part of the brain that's responsible for speech, it can actually shut down.
Wow.
The trauma is literally making it hard to even talk about what happened.
That's crazy. It really shows how trauma can be stuck in your body, outside of your control. It's not always something you can just process by talking about it. And, medication can help some people, but it often just hides the symptoms without dealing with the trauma itself.
So then we come to MDMA. So what is the deal with this whole MDMA-assisted therapy thing? How is it different?
Well, think of it this way. MDMA basically creates this sense of safety and openness, so you can go back to those traumatic memories without being totally overwhelmed by fear or anxiety. It's kind of like turning down the volume on that alarm system in your brain that goes off when you're triggered.
Wait, are you talking about the amygdala, the part of the brain that's our danger detector?
Exactly. In PTSD, the amygdala is kind of stuck on high alert, but MDMA seems to help regulate that response and create a space where you can actually deal with the trauma without freaking out. It's like finally being able to turn off that alarm and start cleaning up the mess.
Okay, that makes sense. But does it actually work? Are there studies that show it's effective?
Yeah, for sure. You sent over a really interesting phase 3 study that was published in Nature Medicine. It was a randomized, double-blind, placebo-controlled trial, which is the best kind of research. And the results were really impressive. People who got MDMA-assisted therapy had way bigger reductions in PTSD symptoms compared to the people who got a placebo.
Wow, so it's not just people saying it works. There's real data to back it up.
Right, and what's even better is that these positive effects seem to last. We're not just talking about feeling better for a little while. Many people kept their improvements even months after the treatment ended.
That's huge. But I'm still kind of stuck on how this all works in the brain. What's happening chemically that allows for this kind of healing?
Well, you know how people say that MDMA makes you feel loved up? There's a reason for that. It makes your brain release certain neurochemicals like serotonin, oxytocin, and dopamine.
Okay, break that down for me. What do those chemicals actually do?
Okay, so serotonin is often connected to feelings of well-being and happiness. Oxytocin is sometimes called the cuddle hormone because it makes you feel connected and trusting. And dopamine is involved in feeling rewarded and motivated. So basically, MDMA creates this mix of chemicals in your brain that makes you feel safe, connected, and open to dealing with difficult emotions.
So it's like setting up the perfect environment for therapy chemical.
You could say that, and this is where it gets even more interesting. MDMA also seems to boost something called neuroplasticity.
Neuroplasticity, remind me what that is again?
So it's basically the brain's ability to change and adapt, kind of like rewiring a circuit board. And it seems like MDMA can really boost that process. It helps you make new connections and pathways in the brain, which could be the key to getting out of those stuck trauma patterns.
So MDMA helps your brain make a new map that doesn't lead back to all that pain and fear.
Yeah, that's a great way to think about it. And The Body Keeps the Score talks about how this rewiring lets you actually feel and deal with those really tough emotions that you might have buried for years. It's like MDMA helps you unlock those hidden rooms in your mind where the trauma's been hiding.
Whoa, that's intense. But I can imagine this kind of therapy must be really heavy. even with the MDMA, going back to those traumatic memories can't be easy.
Oh, it's definitely not a walk in the park. That's why the therapy part is so crucial. The therapists who do this MDMA-assisted therapy, they're trained really well to help you through it safely. They help you prepare for the experience, stay grounded during the session, and then make sense of it all afterwards.
So it's not just popping an MDMA pill, it's about having the right support.
Exactly. MDMA is a powerful tool, but it's not magic. It works best when you have those skilled therapists who get trauma and know how to create a safe space for healing.
That makes sense. You mentioned earlier that the good effects of MDMA-assisted therapy seem to last. How does that compare to traditional treatments like talk therapy or meds?
Well, talk therapy can be really effective, but it can take a long time to see changes. And sometimes those changes don't really stick. And meds, like we said before, can help you manage the symptoms, but they don't really get to the root of the trauma.
Right, it's like putting a Band-Aid on a broken leg.
Exactly. With this MDMA-assisted therapy, we're seeing something different. It seems to help people process things on a much deeper level, which then leads to longer-lasting changes. In fact, the book mentions a study that compared relapse rates in patients on SFRIs like Prozac versus those who did MDMA-assisted therapy. And you know what? The MDMA group was way less likely to relapse.
So it's like MDMA therapy is going straight to the core of the problem and changing how you relate to your trauma.
That's a great way to put it. It's not about just pushing down the symptoms. It's about actually changing how you understand and integrate those traumatic memories. And the research is showing that this kind of processing is what leads to real healing.
Okay, so everything's sounding really positive, but I'm guessing there are risks or downsides too, right?
Of course, anytime you're using a strong substance like MDMA, there are risks. But the important thing to remember is that in these clinical trials, they're giving the MDMA in a super controlled environment with trained medical professionals watching everything. They carefully choose who gets the therapy and they watch over them the whole time.
So it's totally different from when people use MDMA recreationally, where they might take it in unsafe situations or mix it with other things.
Definitely. It's important to see the difference between those two situations. And even though the therapy setting is controlled, we still have to acknowledge that some people might have a bad reaction to the MDMA. There's always a chance of feeling uncomfortable or even in rare cases having more serious physical side effects.
Right, no treatment is perfectly safe. And even though we're talking about all this awesome research and the potential benefits, we got to remember that this MDMA-assisted therapy is pretty new.
Yeah, exactly. It's not a solution that works for everyone, and we need more research. But I think it's safe to say that the early results are pretty amazing.
I agree. It's something to definitely keep an eye on. And it makes you wonder if MDMA can be used to treat PTSD. Could it maybe help with other mental health conditions too?
That's a good question, and it's something researchers are starting to look into. There are actually studies happening right now that are testing MDMA-assisted therapy for things like anxiety, depression, and even addiction.
Whoa, that's really cool. So this deep dive into MDMA-assisted therapy has been super eye-opening. But honestly, I have even more questions now.
I think that just means it's a really engaging topic. It makes us curious and challenges us to think differently about what's possible when it comes to healing and well-being.
For sure, I'm totally hooked. But where do we go from here? What does all of this mean for how we treat PTSD in the future and mental health care in general?
That's the big question, isn't it? It feels like we're on the edge of something huge, maybe a whole new way of thinking about trauma and mental illness.
Yeah, it feels like we're moving past just trying to make the symptoms go away and actually getting to the root, what's causing the suffering.
Exactly. And it's not even just about PTSD. The research on this MDMA-assisted therapy, it's bringing up some big questions about consciousness itself.
Okay, now you've really got me interested. What do you mean?
Well, think about it. If a drug like MDMA can change our experience so much, what does that tell us about how our brains work? How do they create our sense of self, our emotions, how we see reality?
I never thought about it like that. It's like MDMA is letting us peek behind the curtain of our own consciousness.
Right. And some of the research you sent over suggests that MDMA might actually be working on the same brain networks that create our sense of self, our ability to control our emotions, maybe even our spiritual experiences.
So it's not just about treating one specific condition. It's about understanding what makes us human on a deeper level.
That's a really good point. And it makes you wonder what else is possible.
Yeah. Like if MDMA can help people heal from trauma, could it also help people be more creative or more empathetic or even just grow as a person in other ways?
Those are great questions. And honestly, we're just starting to figure this stuff out. There are a lot of stories about MDMA having these deep and lasting effects on how people see the world, their relationships, their sense of purpose. But we need to do more research to really know what the long-term effects are.
I can see why people are so interested in this difficult. It's exciting, but it's also kind of scary, right? We're talking about changing the very nature of consciousness.
It's definitely a powerful tool, and one that we have to use carefully. We need to think about the good things that could happen, but also the risks, and make sure that if we use MDMA in therapy, it's done in a safe and controlled way.
I agree. So as we're wrapping up this deep dive, what's the one thing you want our listeners to take away from all of this?
I think the most important thing to remember is that this MDMA-assisted therapy, it could change how we think about mental health. It's not just a new medication. It's a whole new way of thinking about healing and how amazing the human brain is at changing and adapting.
Yeah, it's a good reminder that we're always learning and growing and finding new ways to help each other on the path to feeling good.
And sometimes those new ways come from unexpected places. They challenge our beliefs and open us up to things we never even imagined.
So to everyone listening out there, if this deep dive made you curious, keep exploring, keep asking questions, and keep an open mind. The future of mental health care to be a lot more exciting than we think.